I'm glad that cancer came along when it did, this kind of cancer, because it was a motivator for me.
Coming up, motivated by prostate cancer. Meet a patient who did his research, asked around, and connected with a world-class doctor. Plus, why he's hitting the gym now more than ever. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Chances are you know someone who has had prostate cancer. 1 in 8 American men will be diagnosed, according to the American Cancer Society. It's common and thankfully curable when it's caught early. Janine Kiesling introduces us to a man who has searched for the right doctor and the right treatment plan.
6 days a week, Paul Henson and his son John can be found working out together. It's a tradition that began last year after Paul was diagnosed with advanced prostate cancer.
I jumped on the fitness train right away. I mean, that is the way to counteract the side effects of treatment for prostate cancer.
That head-on approach is how Paul lives his life and what he credits with his success as a lawyer, a dad, and husband. It's also what led him to the University of Kansas Cancer Center.
I'm an attorney. You never just believe the first thing you hear. With medical stuff, it's just pretty standard for me to say, I'd like another opinion.
Paul was methodical in his research and actually talked to several doctors before he made up his mind. He knew he didn't want surgery. Instead, he wanted to try a multimodal approach: radiation, hormone deprivation, and brachytherapy. Brachytherapy is a cancer treatment in which radioactive seeds are implanted in the prostate with needles to kill nearby cancer cells.
The good sources indicate that brachytherapy combined with radiation and hormone therapy is a very good treatment and decrease the chances of reoccurrence to, well, practically zero.
As for the right doctor, once Paul says he talked with Dr. Ronald Chen, his mind was made up.
He clearly knew what he was doing, had a lot of experience. He was just as willing as could be to answer questions from a patient like me who kind of demands that the doctor articulate why he wants to do a certain course of treatment. Dr. Chen was good at that, better than the other doctors that I had already seen.
Paul says his cancer responded to treatment right away and is almost undetectable in his blood work. He expects to make a full recovery and says his diagnosis has only made him stronger and couldn't have come at a better time.
Here, it's a comprehensive cancer center, one of the 53. It's not like I got to drive from Liberal, Kansas or something every day for treatment. I was retired, so I didn't have to work around a job. I have Medicare, so I don't have to work around insurance. It's like getting a flat tire driving past the tire store. You can just turn in and get it fixed. Well, that's what I feel like prostate cancer diagnosis was for me. It wasn't bad, it was good.
And here we have them both with us, Paul Henson and Dr. Ron Chen, joining us today. Dr. Chen is a radiation oncologist specializing in prostate cancer. He also leads other radiation oncologists as the chair of radiation oncology at the University of Kansas Cancer Center. Deep breath as always. He's Harvard trained. He's editor-in-chief of a medical journal. We could go on. It's only a 30-minute show. So I will just say we're happy to have you back with us, Dr. Chen.
Thank you.
Paul, good to see you this morning.
Thank you.
Thank you for being with us. So what's it like, Dr. Chen, just being reunited with Paul, just a patient and friend?
Well, Paul and I see each other several times a year, actually. In fact, the most recent time we saw each other was at the prostate cancer game at the Royals a couple of months ago. So he continues to come for follow-up. It's great to see you, Paul, in a different setting, but always nice to see him.
Always nice to see him. Paul, say, what's it like to be here with Dr. Chen, talking about your story?
Well, it's kind of like seeing your favorite teacher from law school. It's nice reminiscing of stuff and looking forward to things. It's always good to see him.
So, Paul, something that stood out, I'm sure not just to me but to others, is that you said your cancer diagnosis was a good thing. How so?
I don't know if it was a good thing. It was certainly good timing. But for me, it was just a motivator. The last few years of law practice were stressful and hard, and my health really had gone down. And it was the thing that was just motivated me to, get back on the fitness road and get serious about it.
Not quite the path you planned on.
I did not volunteer for this.
Did
I
not.
got volunteered.
Right,
But
right. So, Dr. Chen, let's just back up a bit. Let's talk about prostate cancer. What it is, what it's doing to the body, who it's affecting.
Well, so prostate cancer, as you said, is a very common condition for men. 1 in 8 men in their lifetime will be diagnosed with prostate cancer. I think one of the questions people often ask is, well, what causes it? Is it genetic? Is it passed down from generation to generation? Actually, it's kind of unsatisfying to say that we don't really know exactly what causes prostate cancer. What we do know is that as men get older, when you get above 40 or 50 or 60, there's more diagnosis as people get older. Only about 10% of prostate cancers are thought to be inheritable or genetic, passed down from generation to generation, and the vast majority are actually not like that, and we don't know exactly what causes it.
So fair to say, if you have a prostate, you're just simply at risk.
I think that's absolutely right, and I think that's why screening is so important.
So the most common way to detect prostate cancer is a blood test. You're looking for something called PSA. Dr. Chen, just talk to us what PSA is, because if you're a man over the age of 50, I guess you need to know what that number is.
Absolutely. I think as we were talking about screening, the best way to screen for prostate cancer is with this blood test called PSA. And it's basically the guidelines recommend that for most men, we should start having annual blood test PSA screening once a year. That's usually done with a primary care doctor. And if the PSA level is high, then it may lead to subsequent tests. But that's usually the thing that needs to be done once a year.
And we talk about this all the time. You cannot underestimate the importance of screening and knowing your body and getting your health checks. So, Paul, were you getting regular screenings?
No, I wasn't.
Okay.
And I don't recommend the way I did it. I had always enjoyed fairly good health. And in fact, a couple of years ago, or a few years ago, I had gone to my primary, who has since retired. That's what led to this diagnosis. And he said, well, when's the last time you've been here? And I said, well, a couple of years ago. And he looked in the records and he says, Paul, it's been 10 years.
Really?
I don't recommend that. And now that I'm on the other end of this, I really don't recommend it.
Right, you're sending a different message for sure. So tell us about that diagnosis. You go to see your doctor. Were you not feeling well? Were there any signs or symptoms? What was going on?
Well, no, there were no signs, no symptoms. My doctor, my primary had retired, so I had to get a new one, and had gotten some referrals from people that I knew, and had gone there just kind of the initial physical and get to know the doc, and did the normal blood test, and then it showed up with an elevated PSA. At that point in time, I didn't even know what that meant.
That was my next question. What were your thoughts? You get diagnosed, it's official. Where do you go from there? We know you ended up with Dr. Chen, which was the best news.
Yes.
But where were you at? Where were you heading?
Well, when I saw an elevated PSA, the nurse from the doctor's office says, we're going to refer you to a specialist. And then there were more tests, MRIs and CTs and other exams, and then eventually a biopsy exam. And the doctor said, well, you have prostate cancer.
Anybody else in your family diagnosed with prostate cancer?
My cousin, not my direct family that
Okay.
I know of.
Right, so you just didn't know much about it. Just a world you hadn't entered yet.
World I hadn't entered it yet, so of course I went right to the research, and it didn't take long to figure out there's good sources for information and not so good sources.
And you said, what were the two things you recommended? Somebody said, what, exercise and Chen?
Yes.
Those are the two things you heard. Those were the buzzwords, exercise and Google Chen. And that's how you found this guy.
Yes. I called my cousin, Steve Henson, who co-founded the Prostate Network here in Kansas City, and said, well, Steve, I've involuntarily joined your club. And he said, I got two words, Chen and Jim.
Chen and Jim. Okay, that's good. So you find Dr. Chen. What was it like to finally connect with him and know you were in the right hands?
Well, I'd already talked to some other docs that I had been referred to from the primary. What I really liked was I emailed Dr. Chen, and he replied to me directly.
He does that.
And he said, hey, let's get you started. Let's get you in the system. So it was, a week or so before I actually met him. But in the meantime, I looked him up. I looked at a lot of presentations he had done when he was in North Carolina, and I thought, this guy is really into this. He's serious about it.
That's a good way of putting it, Dr. Chen. You're kind of into it.
Yeah. Well, I mean, I think there's really a lot to do with prostate cancer. Of course, I see patients, we do treatment. There's always ways to improve how we can tackle this disease. We can always strive for better treatment, better cure rates. We can also strive for better treatments that have less side effects. And so I think one of the really important things in my job is to not only take care of patients, but also to do the research and clinical trials so we can make things better.
All right, we're not done bragging on you. See, you're so humble. But I work in media relations. I've even gotten phone calls at my desk saying, could you get me through to Dr. Chen? I'm like, actually, I can. I know that guy. So that's how needed you are, and people know the name. So Dr. Chen, sometimes prostate cancer is low risk, sometimes it's high risk. Where was Paul's cancer in terms of risk? Where was he at when you met him?
Yeah, I think most people know that for every kind of cancer, there's different stages of diagnosis, and of course, the higher stage it is, the more aggressive, and the prognosis may not be as good, but also the treatment has to be more aggressive. Mm-hmm. So in prostate cancer, I think when somebody's diagnosed, you need to ask, well, what stage am I? And in prostate cancer, we use the staging system. It goes from low risk, which is the best kind, I guess stage 1, so low or intermediate, which is a little bit higher, to high risk, and then metastatic. So low, intermediate, high, metastatic are really the 4 categories where patients can be diagnosed. And the higher it goes, the more aggressive the cancer is, and harder it is to cure the patient.
So was Paul high risk?
Paul was diagnosed with high risk cancer, which is quite aggressive, and I think it really goes to what Paul was saying, which is he had no symptoms from it. I mean, prostate cancer is a silent disease. You can feel healthy, great, not go to the doctor, but it can just grow silently. And that's why I think screening is so important. The more we're able to diagnose closer to the low risk range, of course, the better it would be. But Paul, as we'll talk about, has had great treatment. Actually, his prognosis will be quite good.
Well, let's talk about that treatment, because you did a combination of proton, radiation, and brachytherapy. Mm-hmm. We talk a lot about proton therapy on the program. Very precise. It reduces the amount of collateral damage, so to speak, to the surrounding tissue. It also requires coming back for numerous treatment sessions. Paul, how many proton sessions have you had? What was that process like? What was proton therapy like?
I was scheduled for 25 and did 25 sessions, I guess they call them, and they were consecutive every day, 5 days a week for 5 weeks. I hate to say this, but that was easy peasy.
Proton was.
Radiation, I don't know what the other radiation is like, because I haven't done that, but it was completely painless. It was just an easy process, and the techs really knew what they were doing, and
sure.
You come in there and they ask, well, what kind of music do you want to listen to? And the first time the tech was a little young, and I said, well, let's listen to some Louis. And she just got a blank look. And I said, Louis Armstrong. And she said, what?
Who is that?
So we had a lot of fun with that.
I bet. And you say easy peasy, which is good to hear with what you're going through. You also had brachytherapy with Dr. Chen, tiny radioactive seeds that go into the prostate. Dr. Chen, I'll kind of let you explain what that is. You're better at it for sure.
Well, I think brachytherapy is another way to give radiation, and what brachytherapy is we actually do a procedure, and I think the video showed we use little needles, kind of almost like biopsy needles, mm-hmm. That pokes into the prostate and puts little radiation seeds inside the prostate. The reason this is a very good treatment is because this actually is the most precise way to give radiation for prostate cancer. It actually may be even more precise than proton therapy. It doesn't get more precise than putting the treatment directly into the prostate without going through other organs. And the reason that Paul had both proton therapy and brachytherapy is because he has high-risk cancer. And what I often consult patients about is, when you come here to KU, we will offer all the different options because we have doctors that do all the options. If Paul had just had radiation therapy, the cure rate for high-risk cancer with just radiation, it's about 55%, so almost 50-50. And when you add brachytherapy to the radiation, that cure rate jumps up to about 80%. So if you offer a patient, well, do you want a 50-50% chance for cure or an 80% chance for cure? There's no brainer. And so the fact that we're able to have this technique available to offer to our patients and really makes that cure rate as high as possible makes a huge difference for the patients that are here.
So let's talk about hormone therapy, what it is, why would it be necessary?
Well, hormone therapy is another weapon that we have for prostate cancer, especially as it's more aggressive. So more aggressive prostate cancer may also need hormone therapy. What hormone therapy is it's a medicine. It's actually a medicine we give patients. And what the medicine does is that it will block and reduce the testosterone level in the body. And the reason that's important for prostate cancer is because testosterone, which is the male hormone, actually drives the cancer growth. So the body making testosterone feeds the prostate and feeds the cancer, and that's how prostate cancer grows. And so while when somebody has aggressive prostate cancer and we're trying to get rid of it, we give medicine to block that testosterone so the body's not continuing to feed the cancer, and then we kill the cancer with the radiation and the seeds.
So how's Paul doing now?
Well, as they say, so far so good.
Okay.
There's a monitoring that goes on every 3 months, and the results of those tests have been very encouraging, indicating that the cancer is not active at all.
And how long does that go on? You say you see him several times a year. How long will that continue?
Well, so in prostate cancer, I think it's important to follow patients long term for many years because prostate cancer often is a slow growing disease. And what I usually do in my clinic is we'll follow patients for 10 years. And I usually tell patients that if we make it through 10 years and we don't have a recurrence, you graduate from the program and we're probably done with this forever. But I would say, Paul's numbers have reached undetectable, which is what we want to do. And so I think we're about 9 months into the follow-up, and undetectable is really the best result that we're looking for.
Yeah, so far so good is a good answer. Paul, something you've been doing a lot? Hitting the gym. You let us tag along with you, by the way. Thank you for letting us do that. Why did you up your fitness routine throughout all this?
Well, I was concerned about the side effects to the treatment more than I was about the treatments themselves. The side effects to especially the hormone treatment is if you don't do anything, you could have a fairly substantial loss of lean muscle, weakening of the bones, because the calcium leaches out of the bones. And really the one medicine for strengthening bones is weight training, resistance training, and same thing for muscle loss. If you want to avoid losing muscle, do something that puts it on. And when I sat down and told my family about it, John stood up and said, well, tell you what, I've just started working out.
That's your son?
That's my son, John. He said, how about, I'll text you at noon 3 days a week, and we'll meet over here at the gym. In fact, I joined on his membership, so he got a free month.
Perfect.
And then we've started laying down workouts, and we now do that. We work out together 3 days a week and then work out separately the other 3 days.
Nice.
So work out 6 days a week.
Love it. Dr. Chen, how does that make you feel? Just to know that when he's away from you, he's doing all the right things.
I think it's really important. I mean, I tell many patients that this is a partnership. I will do my part, and if you do your part, we will have the best outcome possible. We do know that prostate cancer treatment and hormone therapy can have side effects. As Paul said, hormone therapy, by blocking somebody's testosterone, can lead to weight gain, loss of muscle. But if somebody were motivated and is able to be active, whether it's weightlifting or just simply walking and having a healthier diet, that can really help minimize some of the side effects.
And you mentioned the team effort, which of course, doctor, patient, and then the support that is around you. You mentioned your son, John. Tell us more about your family, how they've handled your diagnosis and gotten behind you.
Well, the family handled the diagnosis, I think, as good as you can. When you mention a word like cancer, of course, some people can have a strong reaction, but when I told them about it, the one daughter said, well, what stage is it? The youngest daughter said, well, when are you going to get started to deal with it? It was something that we had to deal with, so you just decide what you're going to do. We were motivated to, like they always say, motivation gets you going, but discipline keeps you growing. And we wanted to kind of as a group contribute to a good result. And like I say, so far so good.
So far, so good. All right, be sure to get your questions asked. Use the chat on YouTube and Facebook. You can tweet us or email us at the Medical News Network. The info is right there on your screen. Let's get a check-in with Dr. Dana Hawkinson with our COVID count today. How are you on this Monday?
Yeah, hey, I'm doing pretty good.
Good.
You know, we do have a little bit of an uptick, 19 active patients this week, up from 14, up from 16, I believe, last week. So we're seeing a slow increase in our diagnosed hospitalized patients. But again, we know that there is increased circulation of the virus going on right now in our communities.
All right, Hawk, we're still waiting to see when the updated COVID shots are going to be officially available.
Yeah.
But the flu vaccine, we know, is available now. Evidence is showing that this year's flu shot is very good at keeping people out of the hospital, which is what we want to hear. How do we know that?
Yeah, so we know this from a recent MMWR, Morbidity and Mortality Weekly Report published by the CDC. What they did was they looked at the southern hemisphere. So we know that we have to go with what the southern hemisphere is doing to get our data for the upcoming flu season. That does include trying to tweak the new flu vaccine against what we anticipate will be the circulating strains. We use that data from the southern hemisphere, Australia and South America. There's a recently published MMWR that looks at data from the southern hemisphere, South America, and what it shows is that the current flu vaccine that we have picked and is being in production and available for people does have a good match toward the strains that were circulating down there, and found that there was about a 52% reduction in the risk of hospitalization for those people that did get influenza and had been vaccinated with flu. So that is good news for people. All the more reason to continue to go out, get vaccinated, get your influenza vaccine, but also the updated COVID vaccination, especially if you're high risk, and of course if you meet the criteria of being over 60. Most likely going to recommend across the board for you to get the RSV vaccine as well.
All right, Hawk, thanks so much.
Yeah.
Any reporters with us today? All right, turning back to prostate cancer this morning, we should acknowledge the racial disparity with this disease. Black men are more likely to get it and more likely to die from it. Dr. Chen, not an easy problem to solve, but is there anything that people should know about how we can improve that disparity?
Absolutely. I mean, I think absolutely. I think what you said is absolutely right. If we look at the data across the U.S., black men are more likely to be diagnosed with prostate cancer and also more likely to be diagnosed at a younger age compared to other racial ethnic groups. And also they're more likely to die from prostate cancer than other groups. There's two very important ways to minimize the disparity. One is screening. Screening, catching the cancer early, is the best way for us to maximize the cure rate. And so the national guidelines are for most men, prostate cancer screening should start at about age 50. For men that are at higher risk for prostate cancer, and that includes black men because they're more likely, and also men that have a direct family history, brother, father, grandfather, that screening should start at about 40 or 45. And so making sure that people are getting screening, going to screen. I know sometimes men are hesitant to go to the doctor and whatever, but screening is one way to reduce the disparity if we can catch it early. The other way to reduce disparity is when you're diagnosed with prostate cancer, get a second opinion, get all the options available, and so then you can be informed on what option to choose and not to delay treatment. There actually are good data to show that when black men compared to, for example, white men with prostate cancer, if they're enrolled on a clinical trial or treated at a high academic center, actually the mortality, the death rates are about the same. And so we know that with screening and with getting great care, that disparity can be minimized.
All right, let's get to some community questions this morning. We've got several. Yen Liang wants to know, will doing weight training, like what Paul's been doing, Dr. Chen, does that lower body strength, does that affect prostate health after a diagnosis or even before a diagnosis? Is that something men can keep in mind?
I think, well, I do not know that weight training impacts prostate cancer directly. That's not something that I don't think has been proven. But the other thing that I tell a lot of prostate cancer patients is that for prostate cancer patients, the two biggest causes for death are Actually, number one is heart disease still for prostate cancer patients. Number one cause of death is heart disease. And then number two is prostate cancer. So I recommend all the men that I'm able to see to exercise, to do weight training, because even if it doesn't directly impact prostate cancer, it will still impact their heart health, which actually is the number one threat to these patients.
Ruth Ellen has a question this morning. Why is there a blood test for prostate cancer, but not for breast or colon and many other types of cancers?
Yeah, that's a really good question. I mean, the fact of the matter is that they haven't found a good test for the other cancers yet. And although I think there's a lot of talk about how PSA for prostate cancer is not perfect. It's not perfect. It's pretty good for prostate cancer, and we haven't found as good of a test for the other cancers yet. People are working on this. I can imagine a future. There's a lot of research in clinical trials looking at blood tests for many other kinds of cancer. I believe that there will be a future when we'll be able to screen for other cancers with a blood test, but we're not there yet.
And Ruth Ellen also has this question. Is follow-up for prostate cancer, like in Paul's case, is it just a blood test, or are you testing for other things?
So the PSA blood test actually is the primary way to follow a patient after treatment. And what I usually tell patients, if the PSA is undetectable, then there really is no other test we need to do. As long as the PSA is good, we are good, and that's what we'll follow. What I tell patients is the PSA starts to rise, then that triggers us to do additional tests, whether it's an MRI or a PET scan or a biopsy. But we start with the PSA. If it looks good, that's what we do.
Gene wants to know a couple things. He was asking what Paul's Gleason score is, or did you do a Decipher test for Paul? I don't know what those are. Explain.
Yeah. So the Gleason score goes into the staging system we were talking about. We talked about prostate cancer having essentially 4 stages: low, intermediate, high, and then metastatic. And the Gleason score, which is from the biopsy of the prostate, factors into the staging system. And in Paul's case, as we've shared, Paul had high-risk cancer, and his Gleason score supported that. So that was part of his high-risk diagnosis. The Decipher score is a kind of a newer test where instead of a Gleason score, you send the biopsy tissue essentially to a company, and they have a way to test that tissue, and they get you back a score, and the higher the score is, the more aggressive it is. In Paul's case, we actually did do a Decipher test. The reason for that actually is, and we haven't mentioned, Paul is actually on a clinical trial as well. We were able to offer that here at KU, and Paul agreed to be on a clinical trial to help himself and others in the future. And as part of that trial, we did do a Decipher score for Paul.
All right, Sherry, last question. Sherry wants to know, what's the purpose of the prostate?
So first of all, the prostate is a very small organ that's near the bladder, so it's just below the bladder in a small organ. To be honest, the prostate doesn't do that much. The primary function of the prostate is that it produces the fluid that helps carry out sperm for men. But after men are done with reproduction, for example, then the prostate still makes that fluid, but for many men, it doesn't really have a huge function.
So it just becomes problematic if not screened and checked early. Okay, so let's get our takeaways today. Dr. Chen, what do you want folks to know?
Well, one thing that, again, we talk about screening a lot. I want to talk about the fact that KU, the Cancer Center, offers free screening. I know a lot of men may not be going to their primary care every year, may not have their PSA checked, may not think it's important, and may not have any symptoms, so they don't feel like there's any problem. But PSA screening is really important to catch the cancer early. And I want to highlight, September is Prostate Cancer Month. That's why we're having this program today. KU is offering free prostate cancer screening throughout the year, actually, and the one that's coming up next is on September 23rd, which is a Saturday, from 9 to 12. And it's at 2 locations. One is in the KU Cancer location, Overland Park. So we have a cancer location, Overland Park, and the other location is at our Clinical Research Center here in Fairway. 2 locations, September 23rd, Saturday, 9 to 12. If you want more information, you can go onto the Masonic Cancer Alliance Facebook page that actually has posting of multiple free screenings that are coming up. But Masonic Cancer Alliance is a KU outreach arm, and the information is there. But in a couple of weeks, get people to. You just have to show up.
Do you have to meet the criteria?
You should. Well, we would like people to be either over 50 or over 40 if you have some high risk factors. If you're 25, there's no reason to come for screening. But if you meet the age criteria, you just have to walk in and we'll get screening, we'll get the results back to you. It's so important.
Great information, Dr. Chen. Thank you. Paul, what is the takeaway from your story?
Well, for those men who are in their upper 60s like I am, feeling strong is a good way to go through life. Aging is inevitable, but getting old is voluntary. Get out there, walk, run, work out. It makes life better.
Get out there and live. Paul, thank you so much for sharing your story today. Really important. We appreciate it. Thank you again to all of our guests and to our viewers for being with us today. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Mothers and daughters usually like to share things, except when it comes to an unexpected diagnosis. I'm Jessica Lovell on the next Morning Medical Update. How this duo faced two very different diagnoses, but shared the same dream team when it came to their treatment. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.